confirmed coronavirus caseload has surpassed the 16,000 mark, with a confirmation of another 667 new infections today. The new cases are from 5,075 samples tested in the last 24 hours. 393 of the new patients are male and 274 are female. They are aged between 1 month and 92 years.
Let's take a look at the recoveries now, and 311 more people have recovered from the disease, raising the tally for recoveries to 7,446. Sadly, 11 more patients have died in the last 24 hours for a cumulative toll of 274. Nairobi County once again has recorded the highest number of cases at 387, followed by Kajiado with 79, Machakos with 47, Kiambu with 40, Mombasa with 26, Nakuru 15, and Uasin Gishu County 14. You can tell from those numbers that Kajiado and Kiambu and Machakos are coming up really fast.
Yeah, and actually the Kiambu governor had a few days ago just expressed the concern that, you know, this is actually becoming a serious problem. And today's press briefing on the state of affairs as regards the COVID-19 pandemic left many questions than it provided answers.
Well, the Chief Administrative Secretary, Mercy Mwangangi, confirms that Kenyans are mysteriously dropping dead, but she's asking you not to panic. Why?
Well, because no one knows whether they are COVID-19 patients, and with a higher number of confirmed patients reporting mild to no symptoms, it may be difficult to tell the full extent of infection. And Eunice Omolo will be giving us the story in just a bit.
All right, now to another grave concern.
Yeah.
And we'll get to that in a little bit. Let's first of all hear what Eunice Omolo's concerns are.
Okay.
In what has sent shockwaves among the community and the nation at large, a truck driver collapsed and died mysteriously while waiting for clearance at the Busia border.
Wanasema ni kama kwamba alikuwa amezidiwa na kupumua na alikuwa na kikombe cha maji kwa mkono wake.
But this is not the first case, at least according to the government.
And we've repeatedly announced in some, past press briefings that we've actually identified COVID-19 patients posthumously after they've passed on. We've been able to take the sample.
The other reason it might not be easy to tell is the limited extent of our testing and the fact that 89% of reported cases are asymptomatic. At a time when several Kenyans are reporting being turned away when they seek a COVID-19 test, the government admits it is limited in the capacity.
It says that in terms of our testing strategy, we've often, informed you that in national government, the testing emanates from what is known as our Emergency Operations Center. Our Emergency Operations Center cases is in cases where we are conducting targeted testing. For example, testing of healthcare workers, testing of other frontline workers, people in security, testing of different government institutions, most recently the courts.
What we have been getting from the media is our numbers based on those who are tested. Remember that that is not accurate reflection of those who are infected per se. If you ask me, in terms of the numbers that we are seeing in Kenya now, I would suggest that those numbers are less than 10%.
Among those infected is government spokesperson Cyrus Oguna. Oguna says through a statement, and I quote, "Recently, having come from an assignment out of town, I developed mild coronavirus symptoms and got tested. The results came back positive for coronavirus and I'm now receiving medical care." End of quote.
Of expecting that, officers or any individual, even yourselves, would release the results, really. It requires some better management in terms of respecting individual rights, but also realizing that by drumming all that up, it does also aid in creating the stigma.
But as he receives treatment, reports of yet another high-ranking government official being in isolation treatment at a top city hospital are emerging. Eunice Omolo, NTV, Nairobi.